You are welcome to my channel. Thanks for visiting. Thanks for subscribing. And if you haven't, please remember to subscribe to my channel. Today, the topic will be dimenhydrinate, that is Gravol. Dimenhydrinate could come under different brand names depending on the available brand in your country or jurisdiction. Could be Gravol, or Dramamine, or Draminate, or Good Sense Motion Sickness, Dramavate, Dramine, or Gravol. It belongs to the class of medications known as first generation anti-H1, not H2, like cimetidine, ranitidine, and co. This is H1, also known as ethanol amine derivative. Mechanism of action. It competes with histamine for H1 receptor sites on effector cells in gastrointestinal tract, respiratory tract, and chemoreceptor trigger zone. Chemoreceptor trigger zone is found in the brain, responsible for vomiting. You will know why in a bit. It also decreases vestibular stimulation and labyrinthine function. You all know how this will be related to dizziness and vomiting. Forms can appear in form of solution for injection. In that case, might be Gravol 50 mg per ml, or generic form of dimenhydrinate as 10 mg per ml or 50 mg per ml. When you need to give it intravenously, please, it should be mixed with at least 50 ml of normal saline, but you may give it intramuscularly undiluted. Still under available forms, could be in form of tablets for per oral usage. In that case, might be chewable, Dramamine 50 mg, or generic 50 mg, Draminate 50 mg, or Dramamine 50 mg. And rectal suppository is also available. Note this, it has anticholinergic effect or anticholinergic activity. Can have oxytocic effect in labor, meaning can augment contractions in labor. So, if you don't want premature labor, premature uterine contraction, or miscarriage, be careful when you are pregnant and you are taking Gravol, please. It is easily available over the counter. There's less literature on this medication, such as the full side effects and so on. Uses. Useful to handle nausea, vomiting, vertigo, motion sickness, postoperative nausea and vomiting, radiation sickness, pregnancy-induced vomiting. Also, we have to look for any treatable cause of the nausea and vomiting, and then treat that cause. And why that? Because we want to use less of this medication. Adverse reactions. Remember, I said just a while ago that we don't have full info on the possible side effects, but that is not to say that we have none. So I'm presenting right now what we have as up to now on the possible side effects: drowsiness, dizziness, restlessness, headache, insomnia, nervousness, dysuria. Other side effects will include blood vision, nausea, dry mouth. Remember I said it has anticholinergic effect or activity also. So blood vision, dry mouth won't be a surprise, right? Epigastric discomfort, anorexia, thick bronchial secretion. So someone is asthmatic, or he or she is diagnosed with cystic fibrosis and all the time grabs Gravol, then be careful, that may worsen the situation for them. In pediatrics, Certain complications will follow toxicity of Gravol. So keep this medication out of the reach of children, please. And that will include metabolic acidosis, seizures, renal failure, central nervous system depression, hyperosmolality, and respiratory depression. In other words, this medication can kill children, right? Contraindications. You will not give this medication to anyone who has hypersensitivity to dimenhydrinate or any component of its formulation. So if the history is such that this person has taken Gravol in the past but developed hypersensitivity reaction, then no more. And note this, if this patient had used monoamine oxidase inhibitor in the last 2 weeks, no Gravol today. Or currently on monoamine oxidase inhibitor, no Gravol today. So note that. Anyone with narrow angle glaucoma, no Gravol. Someone with chronic pulmonary disease, remember it can increase secretion along the bronchial tree, right? Someone with prostatic hypertrophy, or patient less than 2 years. In these situations, we will not give Gravol. Part of the warnings will include that at higher doses, it may lead to euphoria, hallucinations, confusion, temporary amnesia, paranoia, and remember, there is likelihood of hypersensitivity reactions like Simi-Johnson syndrome, toxic epidermal necrolysis, or erythema multiforme. Still on warnings, be careful because of central nervous system depression. Therefore, anyone on this medication for particular purpose, taking it twice a day at least, should not operate any machine or drive or any task that will require alertness. Be careful in patients with heart diseases like hypertension, arrhythmias, or ischemic heart disease. Elderly patients may be more sensitive to the side effects of this medication. Be careful in patients who have been diagnosed with angle-closure glaucoma, anyone with liver impairment, anyone with increased intraocular pressure, benign prostatic hypertrophy, duodenal obstruction, respiratory distress, anyone with seizure disorder and thyroid dysfunction. Drug-drug interaction. Because the list is pretty long, I will not delve into that. Please have that robust conversation with a pharmacist or the clinical pharmacologist. Abuse potential. I have decided to bring this out separately so that emphasis could be laid on it. That is very likely. And why that? Because of the euphoric and hallucinogenic effects. But you'll be killing yourself. You'll be doing yourself more harm if you are abusing this medication. So there is that great potential to abuse this medication or use it for this purpose, which is illegal. Withdrawal symptoms. There might be lethargy, agitation, hostility, hallucinations, confusion, aggression, and rebound nausea and vomiting. Examples of where and when we can use Gravol will include a child 2 years and older. So don't give it to that child less than 2 years. Okay. And if you want to give it to pediatric age group, then you get your calculator, right? 0.5 milligram per kilogram per dose intravenously, and you cannot go beyond 25 milligram per dose. If you are dealing with 6 to 12 years, you can give between 15 to 25 milligram intramuscularly. or intravenously twice or 3 times daily. In motion sickness, if you are dealing with older children, you can give it 12.5 milligram to 25 milligram every 8 hours. But I won't even be comfortable to give it 3 times in a day, maybe twice. Adolescents could take up to 25 to 50 milligram, adults 50 to 100 milligram every 6 hours, rectal at 50 to 100 milligram every 6 hours, and the pregnant woman 50 milligram intravenously every 6 hours. I would not go for 4 times a day, these 6 hours, but the manufacturers will agree with that. Another condition where Gravol will be helpful will be radiation sickness. You can give that rectally or suppository, intramuscularly or intravenously at 50 to 100 milligram 30 to 60 minutes before radiation. Okay? Then the maximum you can give here is 400 milligram per day. Another example is vertigo. You can give it per oral, intramuscularly or intravenously at 50 to 100 milligram every 6 hours with maximum set at 400 milligram per day. Okay, once again, I have decided to repeat this slide. That is in pediatric age group. If you are not careful, you'll be doing more harm than good. And parents, don't just grab Gravol and be loading that child or your children with it. Why that? You may run into toxicity in those children, and that will present likely with metabolic acidosis, seizures, renal failure, central nervous system depression, hyperosmolality, and respiratory depression. So, of what benefit is you trying to solve that problem on your own and then tilting your child into serious danger? In conclusion, though this medication is available over the counter and could be given to you by prescription, but don't use it indiscriminately, please. And remember, it is possible that some will abuse this medication, but that may kill you. So don't use it without any reason that is related to nausea, vomiting, motion sickness, or vertigo. Check the uses again. Not for abuse purpose, please. Preferably, have that conversation with your physician, pharmacist, or clinical pharmacologist, so get it by prescription. And don't give it to children indiscriminately. You may kill them. And if at all you will use it, it must be at the lower end, just to be alive, please. I want you alive. With that, I've come to the end of this very presentation. Gravol is readily available, but if you listen to this presentation again, you can see that it is not without its own side effects. Remember to share this. Please remember to subscribe to my channel. I appreciate it.